Hi, my name is Christina Young, and I'm the guest host for today. And with me, I have Katrina Norris. She's the Director of Behavioral Health and Addiction Services. I had to write that down. That's a big title. Before we get to her, I just need to let everybody know that October 28th is the House of Ruth annual Royal Ball, and it is a fundraiser. All the girls from the house get to dress up, and it's really their night, and they get to share their experience, strength, and hope. So I would just encourage anybody, if you need any information, or just get a hold of Sharon, and we hope to see you there. So I would just like to introduce Katrina, and just congratulations on your promotion.
Thank you very much.
That's awesome.
Thank you. My name's Katrina Norris, and I'm with Fayette Regional Health System. And as Christina stated, I have recently been promoted to the Director of Behavioral Health and Addiction Services, which entails overseeing operations at the Care Pavilion, which I've been with the Care Pavilion for 10 years. I started there as an intern and worked my way through the ranks and did inpatient therapy, outpatient therapy, clinical supervision, and have been the director for the past 4 years. We offer a wide array of services at the Care Pavilion, including inpatient services for adolescents that are in crisis, long-term residential, outpatient services, geri psych services, and we've recently added a prevention program that we are just ecstatic about. We were awarded $180,000 by the Family Social Service Administration to bring more prevention dollars, more prevention programming to Fayette County with the focus of how do we fight this opioid crisis and not forget the second generation that is definitely affected by it. So we are so blessed and so fortunate to have a new program manager doing prevention out in the community, a lot of community outreach projects planned for the upcoming year, as well as working hand in hand with Connersville High School to implement life skills training to the students. And that program is evidence-based and really focused on building protective factors, not just combating substance abuse, alcohol abuse, but really all of those life skills that those kiddos need before they step into young adulthood and the temptations that come there. My role will also include overseeing the new third floor detox program at Fayette Regional at the main hospital, and we're just, again, very fortunate, very blessed. We received $9.2 million of state and federal funds, some of which came from the Indiana State Department of Health, and some came from the Ryan White Foundation, because obviously we have a need here.
Yes.
Fayette County seen a 40% increase in drug and alcohol deaths, and we were also the highest drug poisoning death rate per capita of any county in the entire state of Indiana. So this is kind of the epicenter of the opioid crisis, and the state recognized that and supported us in this adventure we're getting ready to take. And we are the #1 hospital per capita in Indiana as well for saving lives of overdose patients in our ER. So we really have seen it day in and day out. We've had 12-hour shifts and 8 overdoses in one 12-hour shift with one ER physician.
Wow.
So we are definitely ground zero.
Yep.
And wanted to do more for the community. We worked very diligently for this program for years in a collaborative effort with House of Ruth and other entities in the community to try to problem solve and combat the problem. And one issue that continuously came up was we don't have a detox center. We don't have a detox center. And as you and I know, as persons in long-term recovery, that's the first step.
Exactly.
That's the first step. You have to get the detox before anything else can happen.
And I know, Sharon, to be admitted into the House of Ruth, you have to be detoxed.
Absolutely.
So usually she has to send them somewhere to get them detoxed and then bring them back to the house. So that's always a struggle.
Sure. And the window of opportunity in addiction is so short.
Yes.
When someone finally gets to that rock bottom place, or they have that epiphany, if you will, and say, I'm done, I can't do this anymore, they need that resource to start the process of recovery. And recovery does not end with detox.
Nope.
That's just the beginning.
Yes.
And so we want to provide that service to not only our community, but our region. Being a level 4 medically intensive detox center, which means we could detox patients that have some pretty significant medical issues. There'll be ICU capabilities on that floor. We'll take benzodiazepines, we'll take alcohol, which a lot of detox centers will not touch because it's dangerous. You know, there's fatalities with those two substances. So we are equipped to handle those. That makes us very unique. The other piece that makes us unique is the HIV and the hepatitis epidemic that has been tied to IV drug use, is that we will give priority to those patients with HIV and hepatitis that are often ostracized, discriminated against from anywhere in the state. We are going to make sure that they receive the kind and compassionate care for the chronic diseases that they have.
Right.
So we're just, again, elated and excited about being able to offer 46 beds that Medicaid and Medicare are accepted. We know that HIP 2.0 has a waiver in to CMS right now that they will begin to cover detox services.
Wow.
So we've done a lot of work and been fortunate to work with legislators that are willing to listen and understand what's going on. Our governor's been phenomenal in this process as well. As you know, he told us he was going to work very diligently on fighting this crisis, and he has kept his word thus far. So again, we're very, very blessed.
Well, and I think a lot of people in legislation are learning that putting addicts in jail, it's just not cutting it anymore. And it's just the user, putting them in jail and prison and not teaching them those life skills and how to get out, not having a plan, usually sending them back to what they went into jail, the same family and addiction, the streets. A lot of people don't even have anywhere to go when they get out.
Sure.
And then it's just, and they're just finally learning that you're going to have to educate and teach, and that's my biggest advocate in recovery is getting clean and not using drugs. That's one thing. But now it's living life clean and learning how to do all those things sober. And, you know, for days and years, I just woke up getting dope, and that's all you know how to do. That's all you think about. So it's a whole life skills change.
It is.
And everything. And I'm just glad legislator and everything's learning. It's putting people in jail. It's just like caging a dog. And if you just don't teach them anything, when you let them go, they're just going to run and do the same thing they did before. So I just think it's great that people are finally starting to see and help. And
I think it's vastly affecting everyone.
Exactly.
Addiction knows no bounds. It doesn't matter if you're rich or you're poor, you're black or you're white. It is really a hijacking of the brain. We can see that medically. You can see MRIs and the effects of drugs on your brain, and the hijacking of that neurotransmitter and the way that people perceive things. You know, you can't guilt an addict into treatment.
Nope.
Because that part of their brain, that frontal lobe, is not functioning the way it used to function. And that brings me to my next point about the family component. Not only do we have to educate the community and the addicts, but we have to also work with their families.
Exactly.
You know, 53% of all DCS removals in our state are related to substance abuse disorders. So this trickle-down effect throughout the state is it's affecting everyone. And I've had people question me and say, well, we could have used this money elsewhere. And I say, well, grant money is allotted for specific things.
Right.
You really don't get to tell the state how you're going to spend the money. They tell you how you're going to spend the money. But also that this is a bigger picture, that we have to, as a community, come together. It's going to take the whole village to tackle this and to work collectively and collaboratively together. It's affecting our children. It's affecting our law enforcement. It's affecting our medical system. 10-year-old stats from Indiana State Department of Health said that we're spending more on health care related to substance abuse and prescription opioid abuse than 38 other states in the entire nation. So that's my tax money.
Ding, ding, ding.
Your tax
Right.
money, everyone's tax money. So even if you're not directly affected in your family system, it is affecting you one way or another. And we know that only 1 in 10 Hoosiers get the help that they need, even if they're crying out.
Yep.
So we've got to do something.
Yep.
We can't continue to bury people. 771% increase in unintentional poisoning since 1999. That's insane. This is a problem.
Exactly.
And I had another discussion with colleagues at the National Association of Social Workers Conference, and they said, why didn't we respond this way to the crack epidemic? And it really made me think about the difference, and the difference being that so many opioid addicted persons started with prescription drugs.
Right.
And again, our state is recognizing it. They're listening, and they are putting in place legislation that limits prescription opioids for 7 days, unless it is a chronic condition. There's some special issues that you could, but the doctors are going to have to document if they're giving more than 7 days worth of opioid pain medication. And the physicians are doing a great job about using Inspect and finding those people that are doctor shopping,
Right.
and rather than chastising them or kicking them out of the practice, they're calling them and saying, it looks like you have a problem.
Right.
Let's get you what you need.
Right.
And this detox unit is the first step in what people need. So when Sharon and I, we've done a lot of collaborative work, and she is just phenomenal.
Yes.
And she said, come talk on my show. It was, I want the community to understand what the hospital's doing, why we're doing it, and what we want to do in the future. And that's make sure we don't have any gaps.
Right.
That we can get people from that ER detox situation or that walk-in, I'm ready for help, detox them and get them in the right place, because everybody's needs are different.
Exactly.
And sending people to the right places at the right time and giving their families support and meeting the needs of the citizens of our region. And that's where we're heading.
That's
So
awesome.
We're just ecstatic.
That's awesome. Now, will the detox center handle pregnant women?
I believe we will handle pregnant women. However, I do have to wait and consult with the
Right,
medical director.
right.
We are searching for a medical director at this point, and of course, the medical director will make the final
Right, right.
decision. I mean, we have all the capacity
Right,
in a
'cause-
medical setting
Yeah.
to assist. And
That's
of
right up
course-
there with the alcohol, because it's just so dangerous. But I know
Absolutely.
being up at the house, one of the biggest things is we
Mm-hmm.
have pregnant women, and nobody wants to help detox a pregnant woman. So you're,
Yes.
it's just like, what do you do?
It's extremely dangerous.
right.
So I don't want to speak before we have
Exactly.
that medical professional in that says, here's what we're going to
Right.
do. But that is one of the biggest questions as we recruit is, how do you feel, how do you treat
Right.
pregnant women that need to detox, and getting them into programs. Again, back to the legislation, they're putting a lot of money out there specifically to pregnant women programs,
Right,
because
exactly.
it's such a shortage.
Yep.
So that was an excellent question.
Oh, well, because, I just know in one of my classes I'd read an article in Kentucky. Now,
Mm-hmm.
if you are pregnant and you drug test positive, you go to jail, and you
Oh,
have
wow.
to enter a program,
Okay.
but they've ran into that problem. They don't have rehabs or detoxes that will take pregnant women, so it's almost like the left hand doesn't know.
Yeah.
But I just know there's just a great need out there for any addict, pregnant addicts, the HIV, the AIDS. So I just think it's great. And how you'd said people question it and the money could have been used. And no matter how much people still want to live in a world with these blinders on, the world just isn't what it used to be. And
Sure.
it's just that it has to start somewhere, and then the family aspect of it is great too, because I'm an advocate. I would love to get another Al-Anon meeting here in town.
Sure.
Because you can love somebody to death. You know, that last
Absolutely.
$20 your mom gave you could be the $20 you die on.
Absolutely.
You know, and so it wasn't until my family tough loved me and kicked me out that I had to put my big girl panties on and realize, you know, it's like I'm either living on the streets or I'm getting help. And the education part of it for the family members, because sometimes they don't know anything about addiction.
Absolutely. And it's hard to understand.
Exactly. If you haven't been
complex.
in it, it's super complex, and everybody just has that, why don't you just stop? Yeah, it's just the vast, why can't you just stop? And it's obviously it's not that easy.
We don't treat diabetics that way.
Exactly.
When they have inappropriate eating habits. And you mentioned a personal story, and my father-in-law, God rest his soul, loved Oreos, and he was a severe diabetic,
Right.
and he would call and say, "Oh, I feel terrible," and I would go over there to check on him, and there's a sleeve of Oreos. Well, that's why you feel terrible.
Yeah.
But I couldn't make him stop.
Exactly. Right.
Even though he knew that they were going to make him feel terrible.
Yep.
But we don't chastise and we don't criticize and treat people poorly with chronic health conditions like diabetes because they make bad choices.
Oh, exactly. Even being, you know, addiction has such a bad stereotype and stigma that goes with it.
Sure.
You know, but if you could just try to program your brain to not think of addiction as in drugs and the stereotype you see on TV, the obese person walking down the street, that's an addiction because they know that weight, diabetes and heart disease, but yet they cannot stop eating the food. You know, it's like addicts know what they're doing can kill them.
Sure.
But they just can't stop doing it unless, just like in all situations, you get the education, the therapy, the resources that I'm just so, like you've said, ecstatic that's coming to town. And it's and a lot of what I see too is going back to how you'd said the whole family aspect, the vicious circle and cycle, the generational curse that we say at the house. You know, a lot of, I think it was 53% of DCS cases, those kids now have parents who are addicted, so there's that genetic factor.
Sure.
And then they're taken out of their home, they're traumatized. I'm sure the statistical rate for children becoming addicts themselves.
It increases the rate on multiple levels. We know the genetic factor is there. You are predisposed to addiction by your genetics. And then the environmental piece, like you said, a removal from a biological family, regardless of the situation, is traumatic to that child and to their development. Right. So we see this at the Care Pavilion all the time, where the majority of my patients have a trauma history. The majority of my patients have had a parent that's been incarcerated. That increases your risk of second-generation incarceration by 50%. So all of these statistics are out there that says we're setting the next generation up for something worse.
Right.
And if, you know, the war on drugs has not worked. We've been fighting a war on drugs since the 80s, and unfortunately in our world, there's always going to be something new.
Yeah.
I just seen a video out of Brazil.
I saw the zombie drug.
With this new zombie drug, and all I kept thinking is please, Lord, please let customs catch this.
Yeah.
Because we can't take any more. And those are man-made drugs. So there's someone that's always going to step up. They're going to change a molecule. Then the FDA is going to have to fight it. And we're going to have to schedule it. And until we build a culture that understands recovery,
Right.
that understands we're all in this together. Law enforcement, treatment, legislatively, we all have to be in this together. And again, the collaborative efforts we've made in this county is just overwhelming. When we have our opioid crisis meetings at the hospital and we have 22 to 30 people show up in various disciplines, that tells me this community cares.
Yep.
And there are some phenomenal folks here that are willing to go the extra mile.
Exactly.
To combat this problem. So we're blessed, we're fortunate to have a community that can come together, that can pull together in order to make a change.
Yeah, that's great.
So
that's great.
The other thing I want to discuss as far as detox goes is this is a short-term program, 5 to 8 days, and they're going to need those follow-up services. So those collaborations are so critical to what we do. And we're also going to implement the HIV testing in the ER. So we'll be the second hospital in the state that does that, so that we can get better data to report to the State Department of Health, and obviously get those folks who didn't know, that had no idea, the treatment that they need as well. And I think that's another huge step in the right direction to really meeting the needs of the community, and understanding what's out there and what's happening. So, I mean, it's a health issue. It's a public health issue.
Exactly.
And we have to fight it like a public health
Exactly.
issue. So.
Now, you'd said the detox is 5 to 8 days?
That's the average. Of course,
okay.
it's going to be individualized.
Right.
Some folks are going to be detoxed sooner than 5 days.
Right.
Some people are going to need that 10 to 12 days. It really is going to be dependent upon their individualized needs, the levels. You know, some people come in very intoxicated.
Exactly.
Some people come in right at the beginning of withdrawal, and each person is going to need something different. And it's going to be about individual care. So, but that's kind of the national average for detox is 5 to 8 days.
Well, good deal. And when they leave, you guys are setting them up with a recovery plan or places to go, or
Absolutely.
are you guys outsourcing a lot? Do you think you'll have to out of town, or are we going to be able to keep a lot? Because I know Meridian and Centerstone,
Sure.
they do a lot of the IoT, and then we have meetings and stuff like that, so I didn't know.
We definitely want to keep them as close to home as possible, because also transportation is a huge
Exactly.
barrier in the recovery community, and we can set people up, but if they can't get there,
Yes.
they can't continue. So we're working our partnerships. We have been to Meridian's facility in Richmond. We know Richmond State Hospital has a pilot program that came out of Senate Bill 499. That they're going to be opening as well for residential services, and then the IoT programs at both Centerstone and Meridian can be utilized, and then also looking at what can we do locally to fill that gap. You know, can we open a residential here? And really just trying to make sure we have all the pieces of the puzzle as close to home as possible, but then also being very aware of the state resources.
Right.
And Department of Mental Health and Addictions has been phenomenal to work with. They have a great map out on their website. So if we get a patient, say, from Kokomo, who they couldn't find a bed anywhere else,
Right.
then I need to know what's going on in Kokomo
Right.
in order to get that person what they need as their recovery plan. So we are going to be hiring approximately 100 people for this unit. A huge nursing staff, because it's a medically
Yes.
intense unit, social workers, discharge planners, utilization review folks to work with the insurance companies, a program director that will run day-to-day operations, master level clinicians to offer therapy in groups and assessments. So it's going to be a large staff, qualified individuals that can get folks on the path to the recovery. And
Right, I mean,
it's a path.
Right, and it's bringing jobs, so I mean that's
Absolutely.
great too. I know, because I was thinking there has to be tons of out of county people that are going to want to come in, because I know Sharon sends people to detox, and it's that you had talked about the transitional home. I'm a
Yes.
huge advocate for that, you know, because the House of Ruth, I have been there 17 months, and
Wonderful.
I'm an advocate for the long-term recovery sense of it,
Yes,
just
ma'am.
because it's a whole. It's just like when people change their diet. It's not just a diet, it's a whole life skill change, and you have to, so many people have the not a great environment to go home to, so it gives them that support, and you have to, people, places, and things, man, you have to get
That's
that
it.
support intact, you know, so I think the detox is great. I think the aftercare is going to be huge, and it's definitely
Sure.
going to help for the long term, you know, because just like we'd said, getting detox is just the first part of it.
Absolutely.
You know, obviously the just say no, It didn't work.
Didn't work.
It didn't work so hot. So,
Sure.
and I also loved the high school life skills class. My motto when I was in high school was, I'll try anything once.
Sure.
Because there just wasn't that education. I'm showing my age. Not that education of, it's like you can try something once and be hooked. And I just think it's just that we're in that time where you have to show the kids the stuff we don't want to show our kids. We have to show them the stuff, it's like I know people, and some people would look at them and be like, you're a little bit overprotective of the never pick up a plastic bottle around town because you don't know what's in it anymore. And there's syringes all over town now. And I hate to say it, but education, we can't be naive that there's an epidemic anymore. Just like you had said. I mean, we just can't. And you can't be an ostrich forever. So it's just.
We are really excited to be a part of not only intervention with detox, but prevention too, because I think these kids know the facts.
Yes.
If you go in and give them facts about drugs, they know them, and they live in a technology-driven world where if they don't know, they Google it. So they then are exposed to other things like this black market where you can order drugs online. So rather than preaching to them, which they detest, you have to go in and take the approach of these are life skills that you can use not only in drug resistance, but in being more assertive, being more aware and knowledgeable, things like violence in the media and how that's portrayed, and not being so naive to believe everything you see on the internet or on TV, things like that. And just really building critical thinkers. This is the next generation. This is the generation that has already been traumatized. They've lived in domestic violence situations. They've lived in substance abusing homes. They've heard the horror stories. It's all over social media and the scanners, things of that nature. So we don't want to come in and say, oh, we're preventing drug and alcohol use. We want to really come in and present as we want to make you a better citizen. And a more productive citizen, because these are the individuals that are going to care for you and I as we age.
Oh, exactly.
And my kids are grown now, and they say, oh, Mom, why do you still work down there with all those kids? You could do anything. And I say, because that's who's going to take care of me.
Exactly.
When you put me in a nursing home. So I want to make sure I'm investing in the future.
And I think it's even as a parent, but even with any kids, I think it's your goal to not let any kid or somebody you care for go through what you had to go through. And so we all know how easy it is to tell kids what to do, but definitely I know the biggest thing too is that perception. You look at somebody, I get a lot, I can't believe you were a heroin addict. You just don't look like one. And that's something else too that just needs to be generalized and out of that stereotype. It's everywhere, it's those kids, and it would just be awesome to show them it doesn't matter what your mom does, what your dad does. If they're still married and you have a $2 million home and your dad drives a Mercedes. It just doesn't matter.
And it can happen, and I've worked with families that is the case where they have been very naive. Because this doesn't happen in middle-class America. Oh, yes, it does. Very, very frequently. So,
well, I think we're actually running out of time. I had a great talk with you. It's just, I love all your information, and I hope, everybody else gets some good information and knowledge out of it.
And I want to invite the community to, if you have questions or concerns, please don't hesitate to reach out. We are the community hospital, and we want to be that staple in this community that people know that they can trust, and that we have a culture of excellence there, and we're just continuing to grow that by opening these service lines. So thank you very, very much.
No, thanks for coming.